The Institute of Economic Affairs is a think tank, and part of our functions is to identify and place before the public conversations on topical issues affecting the economy and on general public affairs. And part of that is to provide a platform for that dialogue, in addition to an opportunity for exchange between professionals and people with an interest in the topical question. Now, today, we are discussing a set of rules that have been proposed, not necessarily promulgated, but been proposed for control of underage drink. We all know that the National Authority for the Control of Alcohol and Drug Abuse in Kenya is a state corporation set up in the year 2007 rather, and among its functions is to administer the Alcoholic Drinks Control Act of 2010, which has had several amendments and iterations since then. Now, a couple of weeks back, a little more than 2 weeks ago, a list of new regulations was circulated in various media forms. Among them were some very drastic changes in existing alcohol control policy. And the idea was to bring these views to the public, and the responses on both ways were mixed. But nevertheless, a clarification was made by the NACADA, the National Authority for the Control of Alcohol and Drug Abuse in Kenya, that these were being surfaced for the purposes of conversation and public participation before they be presented as formal policy. Now, the content of those rules are of interest to the Institute of Economic Affairs because they introduce both supply side and demand side changes to the alcoholic beverages sector, and together with them are certain claims about what the effects that they would have. The main interest being to prevent excessive alcohol consumption, but also to prevent access of alcohol to young people, at the same time to prevent the damage that would result from health in consuming excessive amount of alcohol. So today we have my colleague, Jerop Lioba, who's an intern at the Institute of Economic Affairs, examining those questions. And the question we are asking today is whether those regulations, and we understand they're in draft form and in place for the public commentary and public participation, or the public education, whether those rules would have the effects that are intended, and what are some of the consequences, in addition to those that have been anticipated by NACADA may issue from their formulation, rather from their specific implementation. So that's one. Now, I'd like all of us who are attending here, and we're glad that you're here, to understand that the Institute of Economic Affairs uses this information for public education and opportunity as a platform that we stated. And for that reason, we are recording this event. And this event will then be placed on the IEA's YouTube pages, and it will be available for other people over time to make reference to. So if you do not wish to have your name disclosed, we advise that you send your messages and you let us know about that, or be alerted to the fact that this event is being recorded. So that's the first. The second is that to enable the conversation to proceed without interruption or with minimum intrusion, one of the things that we'll do is we'll keep all microphones muted and all cameras as well blocked, so that you're not able to, while the conversation is going on, we will not be able to have direct access to the video view, except for the presenter and the moderators. But when we ask questions or the question and answer session starts, which is about 25 minutes in from this conversation, then we'll allow you to switch on your camera and ask your questions. So that's the first. The second thing is that we have in the toolbar a chat facility right on the left. It appears on the left of my picture, and it will allow you to ask questions as the session goes on. Those questions will be filtered, and when the question and answer and the panel question starts, panel session starts, our speaker today will respond to those questions. But that stated, she has a formal presentation, and that presentation as well will be cleaned up and will be available on the IEA's web pages immediately after this conversation. So I thank you for that, and I'd like Jerop, who's an intern at the Institute of Economic Affairs, to commence the presentation now. Jerop, please go ahead with your presentation.
Yes,
thank you.
As I mentioned, my name is Cherok Lioba. I am an intern here at the Institute of economic affairs, and we'll be discussing one specific proposal out of many within the NACADA proposal that was proposed on 30th of July in 2025, which the specific one we'll be discussing is the increase in the minimum drinking age. Yes. So you'll give me a moment to start my presentation. The first slide. Okay. Okay, so today the question we'll be addressing is will increasing the minimum drinking age reduce alcohol abuse? Yes, will raising the minimum legal age reduce alcohol abuse? So the contents we'll be going over today are alcohol trends and culture in Kenya, the policy of discussion, economic theory relative to this policy, potential implementation hurdles if the policy is implemented, previous policies on alcohol consumption, alternative policy, and lastly, alternative policy recommendations. So again, for the third time, to introduce this webinar, it will be an economic analysis of the 2025 proposal by the National Agency for the Campaign Against Drug Abuse to increase the minimum legal age for alcohol consumption in Kenya from the ages 18 to 21 years of age. The objective of this analysis is to identify whether the policy will effectively achieve its objective of reducing alcohol abuse. Now, let's go into history and culture. So, alcohol trends and culture in Kenya. Alcohol has a dynamic culture in the Kenyan context. Traditional brews such as busa were occasionally consumed during cultural ceremonies like weddings, but predominantly within elders in the communities or in Kenyan languages, the wazes in the community. However, in the wake of Christianity, colonialism, and Islam, both modern and traditional brews were discouraged. This is a culture that holds precedence to date in many Kenyan communities. Given that alcohol is typically not promoted among adults in Kenya, it is even more frowned upon for child consumption, even in the traditional context. That's where we can see alcohol consumption trends in Kenya are relatively low. Even in comparison to African peers who have similar colonial and cultural history, consumption trends are nearly 10 times lower. On the whole, alcohol consumption in Kenya, as I said, has stayed relatively low from 2000 to 2020, with a slight increase in 2025 to 2.9 liters per person, which we'll see more of in the next slide. Here we can see alcohol consumption in Kenya per capita per year of pure alcohol from the ages 15 years onwards. So this means the amount of alcohol an individual consumes in the span of a year of pure alcohol. Now, upon first glance, this may seem like a lot. The graph is going quite high. However, upon closer inspection, this is within a very small scale of just 2 to 3 liters. So this means that from 2000 to 2020, the span of 20 years, alcohol consumption has not even increased by an entire liter in Kenya. So I assume all of us are not specialists in alcohol consumption. So what does this mean? We'll understand this through the context of comparison to other African countries. Here we have the data from Uganda and Tanzania, our closest peers in the East Africa community. Let's begin with analyzing Uganda. Uganda in 2000 began with alcohol consumption of 18 liters per person per year, which went down to slightly below 12 liters per person per year in 2020. Tanzania has remained within the band of 10 to 12 liters from 2000 to 2020, also remaining slightly below 12 liters in 2020. Now let's go all the way down to Kenya. As we can see, alcohol consumption in Kenya has stayed relatively stable as our graph does not hike very high or go very low as compared to Uganda, for instance. And it is significantly lower, in fact, almost 10 times lower than Tanzania and Uganda in 2020. remaining within the range of 2 to 3 liters per person per year. Now let's go into the next slide, which is global underage alcohol consumption trends. Sometimes the argument may be that Kenyans as a population do not consume excessive alcohol. However, the alcohol that is consumed may be within the underage population, which is problematic. Therefore, in order to identify if that's a situation in Kenya, we will analyze underage consumption both in the Kenyan context and relative to other countries around the world and also here in Africa. So the ages range from 6 to 20 years as different countries have different minimum drinking ages. Let's begin with the United States. In the United States, 33.1% of people under the age of 20 have consumed alcohol before. In the European Union, 37.4% of people under the age of 17 are in fact heavy drinkers, have engaged in heavy drinking. And then in Africa, under the age of 18 years, 42.1% of people have consumed alcohol. Now, let's delve into the Kenyan context, which we can see is highlighted. Within the ages of 6 to 13 years of age, these are primary school students. 2.60% of primary school students have consumed alcohol before. Within secondary school students between the ages of 14 to 18 years of age, 3.8% of them have consumed alcohol before. So what story does this tell us? It tells us a story that relative to other countries, alcohol consumption in Kenya within the underage population is still very small. And this is not to say that it is okay, 100% not. It is just to compare and identify where Kenya stands on a global level. And it's also important to ask the question, will increasing the minimum age now exacerbate this challenge of underage drinking, as the minimum age will now be a higher number? But we'll discuss that in future slides. Let's go on. Now let's talk about the different types of regulatory policies in the alcohol industry. Firstly, there's population-based policies. These are aimed at altering levels of alcohol consumption among the population. They include policies on taxation, advertising, drinking locations, and minimum drinking ages, such as the proposed policy. It's important to note that governments are incentivized to use these policies as they tend to get government revenue, such as taxation policies. In terms of the effectiveness of these policies, it is perceived as less effective as it engages with the supply side of the equation, therefore reduces the supply of alcohol in the market, but may not address the demand. Moreover, it also impacts the entire population, not just individual problem areas or problem drinkers. Next are problem-directed policies. These are aimed at specific alcohol-related problems, such as drunk driving, like promoting a policy. An example of this is promoting widespread random breath testing. This requires less government involvement or intervention, where, for example, widespread breath testing would only involve one sector of the government, which is law enforcement. This also works with the demand side. Lastly is direct intervention policies. These involve interventions directed at individual drinkers. They include brief interventions, treatments, and rehabilitation programs. This also reduces the demand for alcohol, though is appraised to may not be able to address a major chunk of the population, given it only interacts with individuals. Let's go to the next slide. Now, the proposed policy of discussion, the entire reason we're all here. The proposed policy to increase the minimum drinking age is a part of a comprehensive policy proposal produced by NACADA on the 30th of July, 2025. The stated objective of this policy is to prevent, reduce, and control access to and availability of alcohol, drugs, and substances of abuse. Other notable policies under this objective are the prohibition of alcohol sales in restaurants, supermarkets, and home deliveries. The main justification of this policy is to address alarming youth substance trends. However, as we've seen in the previous table, which shows different underage consumptions in different countries, Kenya's youth substance intake is not alarming as stated in the proposal. And then the next justification for this policy is to reduce initiation of alcohol use. However, the policy does not explain how reducing initiation, which is reducing the first time someone consumes alcohol or increasing the age of initiation, will actually reduce substance abuse, which is a stated objective. Now, before delving into whether this policy should be implemented or not, let's delve into some prospective challenges that may arise if it were implemented. I think this first one will be of interest to many Kenyans: drainage of public funds. It's important to note that any policy proposition and implementation is bound to require taxpayers' money, particularly a large-scale policy like the proposed one. Another challenge may be legislative constraints because they may be a transition challenge. So people who are currently within the ages of 18 to 21 will have to be legislated to not consume alcohol through a ban, which also requires a vast amount of resources. And then lastly, enforcement constraints. If enforcement of previous policies or even the drinking age at 18 years of age is limited, then how would this policy at the drinking age of 21 be effectively implemented, particularly as the proposal does not outline a unique plan on how to go about this individual policy and only provides a general plan on how all the other policies will be implemented. This is of concern as with such a large-scale policy, it would be important to have a specific plan as to how it will effectively be enforced. Now let's delve into the economic theory and what it tells us. The alcohol industry exists in dual markets, the formal and informal sector. The formal sector is characterized by regulated supply chains, and the informal sector is characterized by unregulated supply chains. This includes traditional brews and counterfeit brews. Alcohol is considered an addictive good. Therefore, reducing supply in the formal sector will shift demand to the informal sector because of bounded self-control. So this means that given that alcohol is addictive, people's self-control may be limited. Hence, if the supply is reduced through increasing the minimum drinking age, the demand will just shift to the informal sector, which is infamous for being run by major drug cartels and distributing lethal brews, which adds the risk of increasing crime rates in Kenya. Therefore, according to economic thinking, raising the legal age will not reduce consumption, but only increase it in the informal sector. Now let's talk about freedoms. Let's begin with a few basic definitions. A democracy is a political system that vests full authority in the people of a society. Here are some relevant characteristics of a democracy. Rights and freedoms. Democracy grants untransferable rights that cannot be taken away by the government. Rule of law. Laws are passed by representatives of the people and the Constitution. Now, let's talk about the Constitution of Kenya and what it says about all of this. The Constitution of Kenya and the Consumer Rights states that consumers have the right to consume goods and services of reasonable quantity. Therefore, given that Kenya is a democratic country and as a characteristic of a democracy, the government cannot take away rights that are passed through the law, and the rule of law is supposed to be represented by the people and the constitution. If the constitution of Kenya states that consumers have the right to consume goods and services, the good of discussion being alcohol of reasonable quantity, is it within the government's jurisdiction to take that right away? Next, we'll discuss public and private goods. Public goods are goods and goods that an individual can consume without limiting or reducing the availability for others. So, in economic terms, non-rivalrous and non-excludable. So, according to economic rationale, public goods are supposed to be provided by the government, and private goods are supposed to be provided by the private sector in order to maximize efficiency. So, alcoholism is considered a disease. Alcoholism and alcohol abuse is considered a disease. This falls under healthcare, a private good. So, according to economic rationale, this should be addressed by healthcare professionals, given it is within their jurisdiction. Let's also talk about NACADA's role and mission. NACADA's role is to coordinate a multi-sectoral campaign against alcohol and drug abuse in Kenya. This comes straight from their website. Therefore, if their role is to coordinate a campaign against alcohol and drug abuse, is it really within their jurisdiction to pass a policy that bans an entire group of the population from consuming alcohol with limited data justification? Now, let's go back into history and see other policies that have been proposed or passed relative to alcohol consumption. Let's start in the year 2004. There was a policy that was proposed to ban alcohol sachets, which were small pouches including alcoholic contents. The effectiveness of this policy was moderate, whereby it reduced plastic waste in the environment, though was an unintended positive externality or positive benefit, but also increased consumption in the informal sector. Going into 2010, there was a policy which was the legalization of the traditional brew, changa, under the Alcoholic Drinks Controls Act in 2010. It's important to note that this was a deregulation policy and was very effective as it made Changa accountable for hygiene inspections, taxation, and other regulations, which reduced the demand through the increased price of the taxation. In 2010 as well, under the same act, there was a limit on operating hours, where bars over the weekend could only open after 2 p.m. and over the weekdays could only open after 5 p.m. This was very ineffective as it opened the door for corruption, whereby um, whereby bar owners were able to pay law enforcement to operate out of the mandated hours. Moreover, it also increased consumption in the informal sector. In 2013, there was a proposition to require permits for private parties or private parties or house parties. This policy was not even implemented as it was perceived as such a grave violation of individual freedoms. And then lastly, in 2023, Kenya's deputy president planned to reduce pubs to one pub per town. So this policy was very ineffective as firstly, it did not have the proper planning and timelines for it to effectively be implemented. Moreover, it was also very disruptive to the rural or the alcohol industry economies. Yes. Now, just to briefly summarize that, what that says is the only policy that was effective is a policy that was a deregulation policy, which goes according to economic thinking, that majority of the time when you deregulate a market, it creates unintended benefits. Now, let's talk about alternative policy recommendations. We've discussed how this policy at length may not be effective. So what would we recommend to be done? Firstly, redirecting the 48 billion Kenya shillings already collected of excise taxes to address problem drinking and underage drinking. It's important to note that we do not think that it's a major problem in Kenya. However, if it were to be addressed, this would be a feasible route where they could invest in rehabilitation centers or education programs on alcohol safety to reduce the demand. Another proposal is to invest in research and development for healthcare professionals in the industry to create research-driven initiatives to curb the issue. So it's important for us to acknowledge that we are also not healthcare professionals. Therefore, people who are specialists in alcohol abuse and alcoholism are the best place to create policies to address this challenge. Now, to conclude, let's go back to our hypothesis. Will raising the minimum legal age reduce alcohol abuse? We believe it will not. Because, firstly, we believe that there's no major issue to begin with, or it's small relative to other countries, or relative to other issues that Kenya is facing, such as debt. So it's important as economists, we always discuss opportunity cost. So there's always an opportunity cost, whether it's resources, time, and energy to passing a policy. Even the opportunity cost of this time we're spending here on the webinar could go to more drastic issues that are happening in the country. And then lastly, if there was a major issue, this policy would still not effectively address it, given the history and the economic rationale that we have presented. Thank you very much.
So, ladies and gentlemen, we'll come now in a little while to the question and answer. Now, I'll try and sum up what she said in 4 points. So the first is basically to ask ourselves, or rather she says that, look, there's a solution that is being proposed by the NACADA, the National Agency for the Control of Alcohol and Drugs Abuse, administering the Alcoholic Drinks Control Act, and therefore have the responsibility to produce a set of rules and regulations related to that to manage the problem. But the first thing that Cherop asks us to do is to let's ask ourselves what's the problem and to try and scale it or to try and measure it. And from the data that's been provided, and it's fairly solid, comes from comparing Kenya's alcohol consumption to the neighbors. And within East Africa, Kenya consumes over a 20-year period in a time frame, which is significant for the reason that I think in 2010, the informal sector alcohol consumption in the place of what Kenyans generally call China was actually deregulated. Alcohol consumption over a 20-year period in which the population growth was almost 25% larger, did not grow by more than 11%. Is it not 12%? Sorry, 12%, but slightly more than 12.5%, closer to 13. So that's the first point. Then asks, how do we scale that compared? How do we know how big that problem is? What she realizes is that Kenya's consumption on a per capita basis, Kenyan consumption on a per capita basis is about 3 liters of pure alcohol, less than 3 liters of pure alcohol per person per year. That's what the measurement was, pure alcohol per person per year. But we don't know whether that's a good or bad thing. Of course, the medical science part could tell us. Then we go out there to scale it against the immediate neighbors. And it's telling us that Kenya's over that same trajectory over a whole more than half a generation of thereabouts, 20 years, consumption in Kenya on a per capita basis is 1/5 that of Uganda and Tanzania. So it appears that on a regional basis, Kenyans are like moderate drinkers, right? Actually, very, very low drinkers. And then scaling that with the globe, then it comes down to the fact that, okay, compared to global figures, actually, Kenya is like at 1/10 of that, the sub-Saharan, of the African and global figure. So I think on that comparative basis, Kenyan drinking is fairly modest relative to other people, the rest of the world. So that's a first thing. It seems to be a small problem. Now, by saying that it's scaling, she was conscious to state that it's not to say that there's a green flag for more consumption. It should be, it's just to say, look, let's look at what problem you're measuring and what tools would be useful. So first, it's to measure the problem and to frame. Secondly, she goes to the culture in drinking in Kenya and suggests or demonstrates that there are cultural biases against alcohol consumption, leading to Kenyan high levels of religiosity, but also just a cultural reluctance to encourage drinking by the adult population and also for children who are the center of these recent policy changes. So there are things that are pushing against more alcohol, towards even less alcohol consumption, and alcohol consumption has very low acceptability in the country on account of very strong religious traditions, but also a cultural bias, which by itself does not look kindly on Africa on Kenyan consumption on consumption by youth. And let me go to the tools that the government of Kenya has used generally in trying to control for alcohol. And she says that there are three: there are problem and population-based tools, which are basically trying to suppress alcohol consumption across wide populations, and most of these tends to be supply suppression through high taxes, with managing demand, but supply suppression, which is to ban certain kinds of alcohol, to ban the mechanisms for reach and how supply reaches demand. Problem directed, which tends to be more focused on, fine, alcohol consumption is a lifestyle choice for some people. And she said not everybody is necessarily a problem drinker, or at least the definition of the problems on the medical health and its consequences of medical health, its externalities and how it affects other people and all that. And those are true. They're true. But the problem directed is one that's more useful than problem directed, is basically to think about it. Okay, what is this problem drinkers? And secondly, is it drunk driving, or is it binge drinking? And that tends to be a different form of policy. Kenya has tried it, but most of Kenya's historical approach has been directed towards broad population-based, which is to use taxes and that. And there are incentives for why that is useful. It helps government collect money. And the third intervention is direct interventions, which would be basically the more medical science driven, or traffic study driven, or preventive studies and all that. But the focus tends to be population. So a balance of the approaches here would be useful, though she suggests that a problem-directed and direct intervention would be more useful, even if those would not necessarily satisfy cultural, the huge cultural affinity for suppression. Then she goes out there and says, look, regardless of this, I think that there are constitutional lifestyle choices that Kenyans are allowed to have. And part of that is basically consumption. And the constitutional choice to consumption states that, look, people have consumer rights, and those rights are to quality. It's quality. She spoke about quantity, but it's actually quality and safe choices. And therefore brings us to the fact about whether alcohol can actually be, or alcoholic beverages can be provided in safe ways. Remember, we're not talking about underage drinking, because of course underage simply means that it should not be available regardless of the safety. And then the fourth is where we go to the main substance of our conversation, which is basically the limitations of the approach that has been taken. Remember, the approach that she's concentrating on is the approach that wishes to change to ratchet upwards the minimum age upon which Kenyan citizens, individual Kenyan citizens, will be allowed to access and consume alcohol legally. And that is to raise it from 18 to 21, which means that basically a larger share of the population would be unable to legally have access. But she says first, this would require significant surveillance. It would require significant implementation. It would require significant follow-up, and we don't see a cost-effective approach there. So that's one question that she asked. The second is basically the legal construction of this law. Why 18? Why 21? Especially showing that Kenya has low incidence even for people in primary age and all that. 2%. It's not 2% for those between 6 to 13. It's not to say that is encouraged, and it's just about 3% between those who've ever tasted. That's not to mean it's regular consumption, who have ever tasted alcohol within those age ranges. Kenya's numbers are really, really low. Again, we shouldn't have to, but let's state it, because I think this is a culturally sensitive question. That it's showing that Kenya's numbers are low. It's telling you that less than about 1 in 50 Kenyan youth in the ages of 6, Kenyan children within the ages of 6 to 13 have tasted alcohol on even a single occasion. 1 in 50. Not good, because alcohol is not necessarily good for entertainment and for consumption by kids. And you go all the way back to 17, it's just 1 in 30, right? So the prevalence and the shock value that is actually comes from these very aggressive rules is one that our colleague Jerop is telling us to be very careful about. And I think she suggested, not her words, that the attempt to enforce this is basically just generally about there's a moral panic around alcohol consumption based on what she has described as those social, cultural preferences and religious preferences. But the data suggests that, yes, perhaps that's not necessarily consistent with a review, one, of the total consumption, but also in comparison to appropriate comparison to regional, African-wide, and of course the globe. And then she said the reason this problem will be we need to carefully consider it is any attempt to block consumption of alcohol by 18-year-old, to raise it for those under the, to raise the minimum age from 18 to 21 would be dangerous because Kenya has a dual market. Now, that dual market doesn't exist in all countries, but Kenya has a dual market in the sense that there's informal sector alcohol, which is unregulated supply chains, and they're easy to find. It's a distributed network. It is very difficult to enforce against. And therefore, that might actually drive this small population back to the consumption but into that market. And then she almost concluded with the view that, look, Kenya has, or rather, based on NACADA's history, they have this fertile choice of tools that they attempt to implement every so often. Trying to control the sale of sachets that contain alcohol moderately. And you can tell from that menu of choices that few of them have been successful, except for 2010, 2011, when Changa Prohibition Act was effectively abolished, rather repealed. And the effect of that, as is clear, which was basically difficult for people in the conversation, was that there's an assumption that would actually lead to an explosion of consumption of Changa. The data doesn't show that happened. At least 11 years of data is worth speaking of. It doesn't show that happened, suggesting to us that there are really strong moral controls so far on the consumption of alcohol, especially by young people. And therefore leads us to the conclusion in Jerop's analysis that the ratcheting upwards of the minimum age for access to alcohol in Kenya generates costs, and it is not clear that it will be useful for that suppression. And for that reason, she persuades me, and I'm not sure about it, but she persuades me that yes, these will be rules that will be introduced and generate a moral panic. We know that there's very strong push for them, including if you look at newspapers today, there are those who, specific youth groups or named people who actually support this new initiative. So I hope I've summarized that sufficiently and not spent too much time. I was not trying to actually rehash Jerop. She's done a fantastic job. So now I open up to conversations and questions that any of you might have. I've looked at the chat box and there are no questions that have been floated there. Oh, there is. No, there isn't. So I'd like any of you who would like to ask a question to simply raise your hand. And you'll be unmuted and your your camera will be enabled, and then you'll be able to ask questions or make any comments that you have about this question in particular, or anything that you wish for Jerop to bear in mind or to answer. Do I see any questions so far? None? Who has hands up? I don't see any. Let me look at the chart. Well, we have more than 30 people, almost 3,000 people in the conversation. Does any of you have even a question for Jerop? Okay. Oh, Andrew has a question here, is it? Let me see. Yes. Okay. So Andrew asks, other countries have implemented the age increase. What has been the effect? So Jerop, you could respond to Andrew's question, which is that other questions have been implemented that age increase. What has been the effect? Yes. I think it's available in one of the I think it's available in one of the data cases. Do we have any other question? Okay, fine. Let's go with that first, Jerop.
Okay, yes. I think Kwame, I'll give it back to you in a few because we actually discussed this previously, the increase in the minimum drinking age. I'll give the case study of the US. It actually had some major implications in terms of crime rates. I don't have the data approximately, but it had some major implications in terms of crime rates, as oftentimes when parallel markets emerge, which oftentimes happens when a minimum drinking age is increased, these parallel markets are taken over by um, drug cartels and hence oftentimes distribute lethal brews, as I had stated. Kwame, do you have any more information about the case study of what happened in the US when they increased the minimum drinking age?
No, I mean, I was thinking you'd refer to your data chart, which shows that the several countries have had this. I mean, the US also has it in 21, and then speak
Okay,
about
I
it from
see.
from that chart. So, and there's a question from Arjun Shah. Let's ask this so you can handle them together. Would the reduction in drinkers age 18 to 21 as a result of this policy lead to decreased crimes caused by intoxicated persons? Um, so there's that question. Would the reduction in drinkers age, I think it would be the increment actually, it's not a reduction, right? Because it would be raising the drinking age from 18 to 21 as a result of this policy lead to decreased crimes caused by intoxicated persons. Yes, go ahead and please respond to those two.
Okay, wonderful.
If you could put back your presentation so that you can refer to it, because there's a chart you had which was comparing the minimum drinking ages across
Yeah,
countries. That would be
yeah.
useful.
Okay. Um, as that is being set up, I will just try answer it based off of the information I have from the table. So as we could see in the table, the US had underage consumption of alcohol percentage of around 30%, if I'm not wrong, 30% to 33%. It'll be shown on the table shortly. So that means that a country which has already increased its legal age still has more alcohol consumption in within the underage population. So, of course, there are different variables such as population, which we have not considered. But I would say, on the whole, given that the United States, out of every country in this chart, has the highest minimum drinking age, um, is still significantly higher than Kenya in terms of percentage prevalence of people underage drinking alcohol, then I would say that no, it wouldn't have any if positive effect. I would say that it would have the negative effect of introducing now the parallel market, as I had discussed. So other countries have implemented age increases. What have been the effects? So the effects, I would say, have been increasing parallel markets, maybe disruption within the economy. So parallel markets sometimes, not all informal sector, excuse me, not parallel markets, but not all informal sectors are illegal, but oftentimes there are illegal parts of the informal sector, such as counterfeit brews. So it could increase that, which is also increasing crime rates. The next question is, would a reduction in drinking, would an increase, or I would say, would an increase in the drinking age from 18 to 21 result in decreased crimes caused by intoxicated persons? So, given the data that we have shown, I think the best one would be to share the previous policies, um, the table of all the previous policies, and see what it states. But as that is being brought up, I would say no, because as we discussed, according to economic theory, increasing the minimum drinking age will always result in a parallel in the informal sector emerging. Therefore, it's I think it's a Swahili methali, ukikataza mtu kufanya kitu atafanya zaidi. So that means that when you tell someone not to do something and they have access to these brews in the informal sector, then that means that they will not stop consuming the alcohol, hence will not stop the crimes that they may cause due to intoxication because there's still access to alcohol. The policy, it's very important to clarify, the policy only impacts the formal sector. The informal sector goes outside of any regulation and any government intervention. Therefore, the people will still, even if the policy is implemented, people will still have access to alcohol if they're within the ages of 18, of 21 and below. Um, through the informal sector. So I would say that no, I don't think it would have through especially all the data we've provided. And this table can show us how all the population-based policies, which is similar to the one we are discussing, and all the previous policies that have been attempting to regulate the market have not been effective in maybe the intended outcomes would be similar to what you're stating, decreasing crimes caused by intoxicated persons because it only increases consumption in the informal sector. Just a moment, I'm just reading the question. I'll answer it in just one moment.
Okay, let me read it for you. So Anne asks, is there any data showing that there would be a positive effect on underage consumption? My view is that 18 to 21-year-olds will just get older people to buy alcohol on their behalf, especially since these tend to be university or college students. Also, enforcement would just not work. Which probably means that it will be extremely difficult. Yeah.
Okay, yes. So I'll ask to go back to the table with the underage consumption, but as that is happening, I agree with your views that I do not think that there will be a feasible positive effect on alcohol consumption because on underage alcohol consumption, because as we could see, countries that have increased the minimum drinking age have, the US is the example that I had used, have a significantly higher underage alcohol consumption percentage prevalence in comparison to Kenya. So there are a lot of like limitations in terms of enforcement, which we were discussing with potential challenges that may occur if the policy was implemented. We have the view that the policy should not be implemented because there's no major challenge. But if it was, it would also still be ineffective because of all of these enforcement constraints, which is you brought up a very good point that I actually did not mention, is that oftentimes people between the ages of 18 and 21 are in university with other people who are above the age, whereas in high school, it's everyone in an entire high school is supposedly majority of the time under the age of 21. But in university, you can see situations where a first year class, which oftentimes has mostly 18-year-olds, can have a 35-year-old who's maybe coming for a second degree or something of the likes. So limiting that would be very challenging. And then also, as we mentioned, the enforcement constraints of people who are already within that time, that within the ages of 18 to 21 would have to be legislated through an alcohol ban to not consume alcohol until the policy is in effect. And as I stated, I don't have any data to support it, but if there's already underage consumption, even though it's small, with a legal age of 18 years, then how exactly would we expect that this would get better by increasing the legal age? And in the NACADA report, in the proposal, excuse me, there's no explanation as to how that will be done.
Thank you. Let me see whether we have any other questions. We don't seem to have any other questions, but I think one of the things that I'd add before, as I wait for any other question to pop up, is, you see, this policy would also have, and remember, NACADA clarified that these policies are out there for public commentary and conversation before it's formalized and sent to Parliament. And of course, there'll be a policy public participation process in which perhaps they'll be meeting the public in various venues to actually ventilate about views on individual issues, which is a good thing. But remember, what would happen is this: they have either two options. If this policy was passed, meaning that 18% of this part of the policy, which means that anybody, the drinking age would be, the legal drinking age would be ramped up from 18 to 21. It depends on how the transition proceeds. If it was made today, meaning that anybody who's 18 and above who's already drinking or who's had access to alcohol or has access to alcohol immediately become a lawbreaker. So that would be one. Or they would say that we intend to start that in 3 years and decide that 15-year-olds today, when you get to 18, your privilege and your rights to be able to access alcohol, should you choose, will be suspended for another 3 years. That introduces a different transition problem. So that's the first thing that we need to think about. So yes, about the transition, because one way or the other, you're creating criminals, or rather, you're creating violent people who have violated the law immediately by whatever cutoff point, the cutoff date that is chosen. So that's one. The second thing that undermines this policy choice is, and perhaps responding to Arjun's question, is look, if there's a problem with law enforcement related to criminal activity, I don't expect that it would be higher than criminal activity obtaining from the consumption of alcohol itself, because alcohol consumption would have to be a precondition for a person who's taken alcohol to then commit a crime. So the conditional probabilities suggest to me that the crimes committed by underage people, which is basically juvenile delinquency, driven by crime is actually, driven by alcohol consumption is actually much lower than the violations that come from alcohol. And we think on a comparative basis that problem is already a bit too small. So there might be criminal activity generated from the fact that a person who's unable to access alcohol, or rather who should not access legally alcohol, has already consumed it, in which case they've committed a predicate crime, and then thereafter committed another crime out there. So if you look at the crime levels being as low as they are, that's it. One other thing that the data shows, and I think Cherop mentions it, and I just want to amplify her voice, which is this: if you raise the criminal, the minimum drinking age by whatever amount, by effect, what you've done is, because at every age there's a number of people who are already consuming alcohol, as you've seen, by indication, by implication, the first thing that's going to happen is the number of people who commit crimes, the crime rates are going to go up by virtue of the fact that you're actually bringing or widening the latitude for what it is. It's, to use a bad example, is, for instance, if you simply say that, look, something that is legal today was made illegal, it means that for some time the crime rate would rise by virtue of the fact that this is something that people have been conditioned to, and therefore a new law has actually banned it, and that creates that crime rate will go up. So there's that artificial bump that will occur entirely because of that. If, however, as we've seen, the problem-driven choices, problem-directed choices are what is required, then the first problem government should be trying to make is to ensure that those who are the 3% of 17-year-olds and lower who've consumed alcohol at least once, right? That's where to control it, by going for a problem-directed or a direct intervention on that level. Why do these people have access to alcohol? Is it because an adult has provided access to them, which already the Alcoholic Drinks Control Act provides as a crime? So basically that accessory should be found and actually prosecuted. So directing policy focus on those areas is much, much more important than simply widening the net, which would mean many more people will fall into that cracks. And in Kenya's case, that might not necessarily be the case for other countries, but in Kenya's case, we think this is a much smaller problem, suggesting that the social restraints that exist so far for access to alcohol and consumption of alcohol among children are pretty strong. And maybe those are the ones that should be reinforced, as opposed to using criminal sanctions to widen this. And as you saw in the US cases, the higher the minimum age, the greater the number of people who violated it, which is an irony, right? Because it suggests to us. And the final thing that I say, that I think there's a moral panic. Alcohol consumption by children must be regulated. That's one. Two, I think that Kenya has shown, based on the data that was, and that's very solid data, the IE has been following it for a while, has a far smaller, bigger problem compared to other countries than it is. So problem-directed interventions are actually going to be more useful, because as it is, something else exists. But the moral panic that obtains from giving the impression that there's widespread drinking in high schools and widespread drinking, consumption of drugs, in my view, isn't justified by the data. And I think we should go by focusing policy on what the data says. And that's what Cherop has tried to persuade us about. I haven't seen any other questions, but Emmanuel, who's our colleague at the Institute of Economic Affairs here, adds, indeed, people are not stationary objects, easily enclosed by regulations. I think they say that the regulatory authority owes it to the taxpayer to explain the second and third order effects of its regulations. and the cost-benefit picture. I think that's also useful because, yes, policies are important. What we are morally persuaded about is an important thing, but part of what making policy, and especially legal sanctions, because we should be careful about legislating in vain, because then we make a fool of the law, and Parliament specifically should be careful about what it regulates, because law should be something that has consequence. If you have a law that is regulating stuff that society can actually do or can be done through another instrument, then it just creates contradictions about the effectiveness of law in general. I would think as well, let me ask Jerob the question, is, look, your numbers suggest to us or to the audience that alcohol consumption is not zero, but it's a far smaller problem in terms of our consumption per capita relative to the rest of the region within East Africa, and obviously Africa, and even globally. It is. Consumption numbers suggest that. These hard cultural and religious and regulatory push towards more regulation. Is it suggesting that there's an appetite in Kenya for total prohibition of alcohol? Let me see that. Let me see you answer that question, and then we'll tackle a final one before you make your final comments.
Yes, I guess it's, I'd say I'll give normative statements because I do not have any data to justify. However, what I will say is that given that we are democracies are known for having systems that cannot be changed and easily swayed according to who is in leadership and the value system of whoever is in leadership, right? We are a country that appreciates different cultures and different religions, hence should appreciate different lifestyles. I do not believe that it is feasible for a political party or the people running the government to make choices on behalf of the entire Kenyan population based off of their personal value systems, right? We do not give full authority, given that we are a democracy, we do not give full authority to one individual or one small group of people. We have all these different systems from the judiciary to the legislature to the executive to ensure that all Kenyans are represented through our policy. So we have to keep that in mind. Moreover, I don't know what to say about the motives behind this policy. I was very intentional to not discuss why the policy is brought about because, as I said, that is normative. But our role as the IEA is to analyze policies and evaluate if they will be effective. And this policy will be ineffective through the data that we have provided. It may be brought about because of moral appetite or political benefits according to personal ideologies and personal narratives. However, again, that is normatively speaking. Yes, I hope I answered that to the best of my ability. Is that what you wanted me to answer, Kwame?
Yes, I mean, I was just asking about to imagine that if a country already has or registers such low levels in a comparative sense, and you are always careful to say that just because it's low doesn't mean we approve of it, but in comparing it to other parts of the world, we see that it's really, really low based on that data. So that's a first. And yet the push is very, very aggressive towards further regulation. And the combination of those forces is telling us that perhaps Kenya is being directed towards a zero consumption policy, or there's a preference among some for a zero consumption policy based on the cultural preferences that exist here. And so the point is to actually imagine to ourselves, if the assumption is that you should go towards zero or total prohibition or non-consumption of alcohol, total ban on alcohol, what kind of world will you take? And as you say, I think the constitutional order perhaps would clash with that cultural or regulatory approach. The evidence as well suggests that it's not necessarily safe, it will not be cost effective, and that kind of intervention would actually generate many unintended consequences. So
Oh, I can add on that just
Yes, please.
momentarily. I think it would be good to talk about public choice. So, public choice theory states that people within government oftentimes will make choices that are contrary to public welfare because that is where the incentives are are shifted according to the theory. So, aligning with that, we know that oftentimes governments will make choices that do not align with the public, and that's why systems are in place. That's why parliaments are in place. That's why public participation exists. That's why the judiciary exists to ensure that now the incentives are shifted back to the people. As I define, a democracy is a political system that vests full authority to the people of a society. And of course, given the public choice theory, oftentimes incentives are not aligned. And that's why we need to have systems that alter those incentives to now back to the people. So the reason I'm saying that is for us to note that the government will not always propose policies that are beneficial to the general society according to public choice. So oftentimes it is through personal incentives for personal gain. I won't speak more on that, but I'll explain that that is the way that, according to public choice, that a government oftentimes runs.
All right. Okay, we'll be closing, but there are two other questions. There are two other questions, Cherop. So I'll ask those two questions. Let me start with Spencer. Spencer Muhonja. Thanks, Spencer, for sending a question. It says on this, based on your data, it's not our data, it's well collected data, but we are presenting it as part of this TD. I mean, as part of this conversation. Based on your data, there still are some 6-year-olds having access to alcohol. Isn't that worth mitigating, and what would be a better alternative to fix that? So that's one question. I think that's a good question and worth responding to. And secondly, Emmanuel says, what are the effects to the enforcer when the raft of regulations they are to impose are expanded? And he says these are questions that our colleague Cherop has posed explicitly and implicitly, and what the regulatory authority should have answered but has yet to. So you can respond to those two questions, and then let's see if we can conclude the conversation. Yes, Cherop.
Um,
Do you want me to
okay.
repeat the question?
Could you expound slightly on the second question? Then I'll be able to answer them both.
I mean, Spencer Muhonja asks, based on your data, he says your data, but I think
Yeah.
the data that you presented, there still are some 6-year-olds having access to alcohol. Isn't that worth mitigating, and what would be a better alternative to fix that?
Yes, okay, I'll start that question. Yes, it is not, it's important to state that I did not collect all the data by myself. It is not my data. One Cherop cannot, unfortunately, collect all that data. However, that is a very good question to address. If possible, I would like the slides to go back to the table of underage consumption. But in the meantime, yes, it is important, and I kept on prefacing that it is important to note that under one by no means condoning underage alcohol consumption, and the amount of people, like for example, 6-year-old who are consuming alcohol is something we don't have data on. It's just the group of all primary school students from the ages of 6 to 13. So I don't have the percentages, but the likelihood of the majority of that primary school population being 6-year-olds who are consuming the alcohol, not 13-year-olds, is slightly normative. But that is why we advocate for problem directed policies, right? So this is a problem area you've identified very clearly. That's good. So that some primary school students, 2.6% of primary school students have consumed alcohol before. That is a challenge. We need to mitigate that. So it would be most effective to address that through policies that are directed at that. I do not have any policy recommendations off of the top of my head. As I mentioned, that we are not drug abuse and alcohol consumption specialists. But what I will say is that a problem directed policy for specifically the age bracket of people under the age of 18 consuming alcohol would be most effective. So maybe going to analyze school environments, which is what they're stating, that in primary schools people are consuming alcohol. So going to analyze school environments, identifying problem areas where schools, where people often consume alcohol within schools, and then going to those problem areas and directing policy to those problem areas. And that is not just beneficial in terms of reducing the scope of the policy, which will help its effectiveness, but it's also beneficial in terms of public funds. It is not realistic to implement a policy that impacts the entire of 52 million Kenyans, not 52 million Kenyans, but just the amount of Kenyans who are between the ages of 18 to 21, and our problem area is primary school students in X region within the ages of 6 and 13. And the whole hypothesis of this webinar is to understand, will increasing the minimum drinking age reduce this population? So reduce alcohol abuse or reduce the 6 to 13-year-old um people who are consuming alcohol? No, because I do not see any correlation between increasing a minimum age and the people who are already consuming alcohol. It doesn't affect them regardless, because they are already under the age of 18. Yes.
Okay. There's another question as well. I think we'll take this as the last one before we still have like another 15 minutes, but we'll take this question here. Professor Ezekiel asks, what is the main reason of the policy? Is it to eliminate alcohol consumption or the number of users? I think that's a good question as well.
It is a good question.
Gerald, go ahead.
Yes, so I analyzed the proposal at length, and I did not find any justification for the specific policy from what I saw. And all I saw was the objective of this policy is to prevent and reduce access to alcohol or substances of abuse. So that is it's also at the introductory slide. So that is the only reason that was stated in the policy proposal for this policy. So to identify, yes, wonderful. So to identify whether it'll effectively achieve the objective of reducing alcohol abuse. So again, we are not the ones creating this policy or proposing this policy. So we do not know the different factors that contributed to the policy and the reasons, but it mentioned that there are alarming trends of youth substance abuse, but through the data that we've provided directly from that policy, those trends, so the 2.6% of primary school students and 3.8% of secondary school students, is very small relative to, for instance, the 37% of people under the age of 17 consuming alcohol, heavily consuming alcohol in the European Union. So in the European Union, is it to eliminate alcohol consumption or the number of users? So it does not state whether it is to eliminate alcohol consumption or the number of users. It just states that it is to reduce alcohol abuse and addresses alarming youth alcohol consumption trends, and reducing the age of initiation, which, as I mentioned during my presentation, is not explained as to how reducing the age of initiation, which is reducing the first time you consume alcohol, will change the objective, which is to reduce alcohol abuse, or will impact alcohol abuse.
All right. Okay. Well, we haven't had any other questions, but right now I'll ask you, Sherop, to highlight and to make your final comments. So if there are things you think you need to highlight, perhaps this is the moment to do that. And then any other final comments that you may make so we can close the meeting.
Yes, wonderful. So firstly, I'll first start with thanking everyone who showed up for this webinar. I'm greatly appreciative for your time to listen to my presentation. This is the first time I've done a presentation in a webinar, so I'm very grateful for all the support that I've gotten from my colleagues here, also at the IAA, who have helped me with loads of practice for this webinar. Yes, a soft copy of the presentation will be shared on the IEA website. Sorry, to answer a quick question. And then to briefly highlight key takeaways that I think that we should mention from the presentation. This presentation, again, by no means is condoning alcohol consumption or condoning underage alcohol consumption, but it's just an analysis on a policy, which is what the IA does. It's a policy think tank that analyzes different policies to see if it will be effective or not. So the more I'd say political questions as to why the policy came about. Is it motivated by this, that, and the third? Is not within our jurisdiction. It's just to analyze the policy and identify whether it will be effective. Another thing that I feel as though we've not mentioned enough is that there are already policies existing regulating alcohol. I recall 48 billion shillings already collected in 2025 of excise taxes from alcohol consumption. So this is not to say that there should not be any policies regulating alcohol consumption. There are existing policies, but it's to say that this policy will not be effective if it is implemented, especially since relative to other countries, again, this is normatively speaking, I don't have any data to justify it, but relative to other countries, Kenya is pretty strict on alcohol regulation already. So it's not that we are ignorant of the challenges that may be caused by problem drinking or underage drinking. It is just that this policy may not be effective given the data of Kenya relative to other countries, and then most importantly, other policies that NACADA has proposed and implemented throughout history. Yes, so I think those were the two major points that I wanted to amplify one more time before we close. Yes, I'll just say thank you again for taking the time to listen. Thank you for asking questions. It's really got my brain thinking. So yeah, I'm very grateful. Thank you, Kwame, for chairing this meeting and for adding on to the points I have made.
All right. So thanks a lot, Jerome. I'm glad for that you have this opportunity to actually provide an opportunity for a younger person in the age group under focus to actually discuss not just views, but to bring evidence to this conversation and to elevate the quality of public discourse around this. We're grateful for that. But I'll summarize what she says in 2 points. The first one is Jerome agrees with the objectives. I mean, nobody wants underage children to have access to alcohol. It will be damaging to their health. It's not socially good. And we have strong social and moral fences around this country drawn around access to alcohol generally and especially to children. So that's an important thing. So she agrees with that objective, and so do we. What she disagrees with is the policy tools that are being proposed. Because if you're interested in defending, protecting children, and already 2.6% of children in primary school going age, it doesn't mean 2.6% of children or 2.6% of children in primary school. I think we need to frame this properly. That survey shows that 2.6% of children in primary school going age, which is 6 to 13, have consumed alcohol at least once in their lifetime. That's a significant number. So it's not to suggest there's a problem drinking question there, but at least have had access. And in our view, that's significant because it's suggesting that if there's a lapse, and that's already low by global precedent, but if there's a lapse, it's a lapse that's related to the access that they have from the inattention of an adult who's supposed to protect children from having that access and actually to taste that. That directs us to the fact that, therefore, a policy of expanding the bracket by ratcheting upwards the drinking age is not going to solve that problem. It's actually just redefining the problem and all that. So we like a greater focus on what policy tools are useful for bringing those children to safety, whether it's the access that they might have from home or whatever it is, somebody is failing them and it's an adult. And raising this age is not going to solve it if those kids are already up there. So that's one. I'll respond to Spencer, who was asking if there are still some 6-year-olds having access. That's true. Isn't that what mitigated? That's true. And our question is, mitigating it by raising the minimum age is not going to solve that problem because it's already legal as it is. So it's suggesting that, yes, it's a small leakage, but it's still significant, and we think attention to be driven. And that's why problem-driven policies at that level. Is it something around the household? Is it something about the adults around the child? What it is, that's what we need to solve in terms of rearming those adults to be able to keep children within in safety. The second point from Ezekiel is basically what is the main reason of the policy? Is it to eliminate alcohol consumption or the number of users? And Jerob says that it's a generic message, which is to prevent people to have access to it. But Ezekiel, in our view, that wouldn't matter. Eliminating alcohol consumption would be difficult because that is a drive towards prohibition. We know societies that have had prohibition and have very strong strictures on alcohol as well. The US, 1920s, 1930s, we know how that story became. The richest people and the most violent criminals were people trading in alcohol. And it was also prohibited in the US. That policy was an unmitigated disaster. It's an unequivocal failure based on social, health, crime control, even economics lenses. So it's not an experiment worth repeating, even if it's not an experiment worth repeating. Now, in the quantity, number of users, I don't know whether number of users is also useful, coming from a constitutional requirement that people be allowed to consume things that are safe. We'd have to ask, preventing them from consuming unsafe products would be useful, but preventing people from exercising, from asserting their rights to choose lifestyle choices. And for some people, alcohol consumption is part of beverage consumption is part of how they celebrate a good meal and stuff like that. So our focus should be much, much more narrower about problem or people who are problem drinkers. And to be honest, the industry in this country and NACADA and the Ministry of Health have various programs which could be expanded to educate people on not just safe consumption, how to make choices, and to try as much as possible to delay the onset of that consumption all the same. But trying to control the volumes or trying to control the number of users is, in my view, is an insufficiently targeted program, because the problem is not all users. The problem is actually those who have problems with committing crimes, drunk driving, for instance, careless consumption, and those who violate laws and harm their own health in other ways. So, ladies and gentlemen, I mean, we are glad that you've been here with us for the last 1.5 hours. And I'd like us to appreciate the presentation by Jerob. Thank you very much, Jerob, for this. And my colleagues at the Institute of Economic Affairs who made this possible. We apologize, there's a small mishap for 2 minutes at the beginning, but it's all here. And as Ezekiel asked, yes, this presentation is going to be made available. We'll provide a commentary together with in a separate blog post, but this presentation is going to be made available within an hour of the close of this meeting. I'd like to thank you all for supporting the IEA. Please note that the IEA is a professional association, and we'd appreciate if you consider being a member, whether at the corporate level, whether at the non-profit level, or as an individual. We're expanding our membership, and we know that it will be useful for you to have an opportunity and to suggest platforms, to suggest other things that we could discuss. Before I close, I'd like to let you know that this week is a busy week for the IEA. Tomorrow, we'll be discussing, in another webinar, starting at the same time, discussing the fact that the Auditor General released a report on an assessment of the e-citizen, which is a government payment system. And we're discussing that report has been circulated widely. We'd encourage everybody to read it as an active citizen and a Kenyan taxpayer. It has significant implications for policy, and we'll be concentrating on discussing what are the policy lessons that study tells us. And then on Friday, we'll be discussing Kenya's export behavior over the last 20 years and telling us where the competitiveness lies and the structure of Kenya's trade system. So please, if you consider, please join one or both. We'll be very, very glad to have you here again. Thank you very much, and I thank all my colleagues who are here and those who made this possible, together with all those who compound.